Welcome everybody to this COVID-19 discussion series. I want to say that this series has been organized by the American Association of Medicine and the Person, which is a non-profit organization here in New York. And our mission basically is to promote conversation and discussion among professionals, among doctors, nurses, administrators, researchers, students, with the aim of building a culture that offers the dignity of each person in medical care, medical practice. So the American Association of Medicine and the Person carries out its mission through the annual organization of the Med Conference, which started in 2009. And many of you in the audience probably are familiar with that, and you came to one of these editions. Unfortunately, this year we had to cancel the conference, and we decided instead to offer a series of virtual meetings. And we decided to invite professionals fighting the pandemic on the front lines. Now, this choice maybe seems a little bit obvious because everybody's talking about COVID-19, but we are particularly interested to discuss two big issues. First, which are the challenges for medical profession in this time of pandemic? And we want to hear from people who live this firsthand. And second, is it really true that there is a wellspring of humanity within this very, very dramatic experience? Now, instead to invite our speakers to give a talk, we decided to keep a format of an interview so we can ask specific questions to understand more about those two big issues that I mentioned before. And we prepared some questions, and we also included questions that came from our audience that you guys submitted to us. And at this point, I pass the microphone to Dr. Mariani, who will introduce Dr. Capetti. Thank you again.
Thank you. Thank you, Elvira. So this is a situation of uncertainty, of vulnerability, as you know, and but at the same time, this is an opportunity to open our eyes, to recognize what is important, and the importance of things that we take for granted, like family, or our personal relationship with patients as a healthcare provider. And when there is a situation of uncertainty, we can either close in fear and protect ourselves, or we can listen, look, pay attention, look for people who are greater than the fear. They are greater than the disease, who in a certain way incarnate this victory over fear. And look around, we see people like that. Dr. Amedeo Capetti is a dear friend of mine. From medical school in Milan, we did medical school together. He's a little bit older than me, but we did medical school together. Ahmed, we were calling him Ahmed, and Jamfrey. Jamfrey was his friend, and they were taking care of patients with HIV. And then I've seen Amedeo most recently, just this summer, or 2 summers ago in Italy. And I look at him, and he was, I see a person who was helping a little child that had some problems in walking to walk. And I said, who is this person? And it was Amedeo. And I was struck by the way he was just staying alive. And so then we stayed in touch. And then most recently, Amedeo wrote a moving letter because he's taking care of patients with COVID now. And he spoke about the disappearance of complaints, the vulnerability that help us open our eyes and recognize that everything is a gift, recognize that we are friends. So all of this is what we were struck by Amedeo. Amedeo is licensed in medicine in 1989. And then he specialized in infectious diseases in 1993. And he started to take care of HIV-infected patients at the Luigi Sacco Hospital in Milano. And then he has been responsible since 1991 for research and development in the first division of infectious diseases of the Hospital of Milano. He's a professor of human physiology, and he's a technical consultant for the Holy See at the World Health Organization in Geneva. He's married to Maria. He's father of 4, and 2 are now physicians. And since 2005, they had 13 fostered children, 2 of whom are still living with them. So please join me in welcoming Amedeo. And thank you, Amedeo. And now I give the word to Dr. Giulietta Riboldi, who will start with the question. Thank you.
So thank you all again for being here today with us, and thank you especially to our speaker for accepting our invitation and for finding time to join us despite his busy schedule. As we said at the beginning, we collected several questions and topics that we would like to discuss today with you. So without further hesitation, let's start with our first question. As we heard, you have been and you are in the front line in this pandemic in a big hospital in Milan. And we are all sure of how difficult that has been and probably still is. Therefore, we would like to start asking you about what were the most challenging aspects for you in your work in this fight against the COVID-19?
Yeah. Well, pandemics are something really strange because they come very, very quickly, and also they tend to disappear quite quickly. We hope so, at least. But they come very, very quickly. So the first thing was that in a few days, we were jammed of patients and very seriously ill patients. And we had to open from one day to another new wards to these patients because they exceeded our possibilities. And to recruit other personnel who was not accustomed to managing infections. And this happened all over Italy. So we had surgeons, we had, internal medicine doctors. We had even in some wards, psychiatrists who had to take care of pneumonia. So one of the things that circulated at the time was beware of not getting COVID, or else your pneumonia would be cured by a psychiatrist. So that was quite a big problem. In some hospitals, they did, I think, something very intelligent. So they did mixed teams. In our hospital, no, we were all infectious diseases specialists, and the doctors were in the internal medicine doctors were in the other wards. The second challenging aspect was that we were really orphans. The Chinese epidemic did not tell us, it told us very, very little because it had been faced mostly with the army, and little with the health aspects. So we just knew that maybe antiretrovirus could be of some help. We knew that it was a problem with dry cough, pneumonia, bilateral pneumonia, but we did not know at the time all the clinical aspects of this disease, and also the drugs. So at the beginning, we did not have randomized clinical trials. We are starting them now. And so we had to contact the US, where a new drug was rapidly available as a compassionate use. That was remdesivir. But it was very hard to find it and to give it. So the main thing at the beginning was to give high flows of oxygen to our patients. And but also this was rather challenging because we didn't have enough helmets. And sometimes we had to decide that a patient was going a bit better, so just take off his helmet because there's another one who really needs it, and he risks to die if he doesn't get the helmet. And also every day our ICU doctors came to our ward to teach us to use high flows, because the lungs of these patients were quite soft and they could expand very easily even with high flows. And we did that, but after a while we had at least I remember one patient who died. He was 48 years old, of bilateral pneumothorax, because of the high flow. And I had raised that high flow the night he was gasping. I knew that there was no other way. I did not know he was going to have pneumothorax. So we were really happy when Professor Gattinoni reached at Bergamo, the local team, and he saw the situation, and from his experience he taught us that that was pneumonia, but really it was thrombosis. So we had to use high doses of heparin to resolve the clots, because we were giving a lot of oxygen in parts of the lungs that were not breathing. So it was useless. And I think this was really a step forward. High flows, but also heparin. And at the time, working with the WHO, we still have twice a week meetings with all the people around the world, all the specialists around the world. And the WHO said you have to perform randomized clinical trials. You cannot just give drugs to anyone like that. And also the strange thing is that in the whole world, we were giving almost the same drugs, but there was and there still is very little evidence that they work. And so, you make a step forward and you say, maybe lopinavir does nothing, so step back, no lopinavir to anyone. And then, well, that drug is very interesting, but you have no evidence at all. And this was quite challenging, yes.
And as you were mentioning, you probably find yourself in situations that were new for you and for many of your colleagues. Like, for example, as you were briefly mentioning before, the challenge of rationing ventilators or supplies. So I think it's been a question for many people of how did you manage these new situations, and what guided you and your colleagues in like this new condition in which everyone found himself in this situation?
Yeah. Well, I think the difference probably is between hospitals, because we are in a, let's say, middle-sized hospital, but quite well equipped. And so the ICU established just at the ground floor of our department. And so generally we had sufficient helmets. Well, we had in some periods some shortage, but never dramatic shortages. And we had every evening and every night doctors from ICU coming up, because they had a list of patients who were seriously ill, and we had to call them every time and say, well, I think this patient is going worse. I think it's the time to bring him down. And one of the facts is that being so jammed, they tended to bring down the patients probably too late. It was not a tragedy for us. We did not see these patients worsen. They went down in ICU, but most of them were really too tired. Mainly their thorax muscles were too distressed, so they were not able to breathe any longer, and so they died in ICU. We had to update every time for the WHO our data, and we saw that mortality in wards was about 6%. The mortality in ICU was around 35-40%. So this decision generally came too late. But the most dramatic aspect was in little hospitals, because as I told you, the pandemics came so rapidly, in particular in the provinces of Brescia, but more than all in Bergamo. And in some parts there were only small hospitals, where I know a friend who works in orthopedics, and in his hospital all the COVID was taken over by orthopedics, and they did not have an ICU, so they had to send patients to Bergamo. But Bergamo had limited place, so their patients arrived to the helmets. If they could go back from the helmets to normal flows, well, if they had to proceed to intubation, that was really a problem. So few of their patients could proceed to intubation. And also knowing that thing, in several families around in the zone, they said, well, if I bring my parent to hospital, he will die with a helmet. I won't see him. And so I know that nothing changes. So I will keep him at home and he will die at home. And this was really a tragedy. I had several calls with friends, doctors from Bergamo, and really the situation was very, very dramatic. Now the situation in these provinces is much better, really. They have less infected patients overall than in Milan. But in Milan, the infection went quite slowly, and the mortality is much lower.
And for what you just said, you probably saw many cases of these people dying alone in the hospital. And we received many questions also from the people who are following today, asking about this particular topic. So of people dying alone, and so the struggle for the person who is dying, and for his or her loved ones. So for what you see, what did help you, or what could help, like in this situation, living this very tragic situation?
Yeah. So I have two aspects. One is it came out really at the very beginning, because the first patients were really the most seriously ill, and suddenly I realized that they were dying even without. I found that the translation in English, last rites. We say Oli Santi or Estremunzione in Italian. It's a rite with which the churches benedicts, how do you say, no, not
Bless.
benedicts, blesses the last moment of a patient. And it's also a way, you know, to die with dignity. um, but this was denied, so I asked my head of department to allow our priests to get in and give these sacraments. But he said, no, I don't want them to be infected, and then it would be my fault. And I said, well, I called them and I said, do you feel you would like to get in, because I don't want to, you know, to sell your life. And then I returned to my head of department, and I returned with them, with one of them in particular, and he said, well, I want to get in. If someone trains me, I would get in. And so he started to get in, to give the communion, to confess the patients, and to give them these last rites. And this was really important because, well, I would say Italy is a country where still at the bottom of a lot of people, religion is still present. I can see it from my HIV infected patients in all these years. They are drug addicts or, you know, marginalized people, but not all, but at the very bottom of their soul and of their life, religion has a place. And so this was really meeting the patient's needs, so that the priest had a lot of requests in all the wards, and he had several days where he had to dress and undress, and he had a lot to do. And the second thing is that for us, for all of us doctors, after visiting the patients at about 12, okay, uh, 12 a.m., 1 p.m., we received all the telephone calls from the relatives of the patients. And we were very, very careful, and you know, we gave all our yes, medical answers, but also I would say love from all my colleagues, even, you know, colleagues who may not be normally keen on loving relatives of the patients, because they tend to perceive them like, you know, something that that gets in your daily work and disturbs. But we were very, very all very we really took care of these calls. And in my case in particular, I would say that this has been the beginning of relationship with these relatives that continues still now. I would say almost every day we get in touch, and you know, to know how they are going, and because it's just a friendship that has started from that. It's now we don't speak now of their relatives who died. We speak of daily life. We you know, of the problems of daily life, because of course, being locked down, it's still a problem for many. And you know, the way to keep our sight high, to not to collapse on the problems.
And starting from what you just said, so going on these struggles or this dramatic situation, how would you see that your conception, your idea of your medical profession changed? And how would you envision that the medical profession would or should change in the post-pandemic era?
Yeah. There are, I think, also in this case, there are at least two aspects. I think my mind is not wide enough to go to three, so I will tell you these two. Yeah, and one is quite a practical issue, and it's collaboration among specialists in a hospital, which has been very close in this situation because we were all involved in fighting a disease which was, as you said, Julia, new for everyone, and so dramatic that we. I won't say we had to work together. We found just working together and with the same aim, and that makes friendship rise. It tends a bit to abate differences. But this is something that we have to keep in mind and continue. And also with the general practitioners, because that was very neglected aspect in the Italian pandemics. I think in most provinces, sure in our region it was really neglected. They had few instruments and many of them stopped visiting patients. They didn't want to go to the patients' houses because that was really dangerous, and also because not having the protection instruments, it was really dangerous. And so we started at the beginning considering everything from the hospital point of view. Now we are much more moving on the territory, and what I am trying to say to all, even to the authorities and to the local authorities of my hospital, is that our ancestors, okay, when they were fighting an enemy and when the enemy was defeated, they wouldn't let the enemy just go away, withdraw and run away. They would follow the enemy and they would exterminate the enemy until the last enemy would be alive, because they didn't want the enemy to come back in the future and win. Okay, so this is what we have to do now, and this is impossible without general practitioners. So we are starting a very good collaboration with them, and I think this is the only way. Oh yes, the second thing, just let me think, I forgot. Well, it may come back in the future. Yeah, I had only one. So be quick, Julian. Next time I will have 0 answers.
So no, but like along with what you were saying, you were starting to saying about this collaboration or friendship that start growing, especially with colleagues. So in this situation, we also heard like from you now, but also from others, of many stories of rebirth in humanity, both in the healthcare professional or patients. So would you agree that that there has been this wellspring of humanity in this situation? And if so, would you like to share some examples or stories with us?
Yes. Well, I think that there has been sure something, but I also think that tragedies do not necessarily teach something unless you see something else. I can try to explain. For most of my colleagues at the beginning, especially the colleagues who already had this position in life, is that they gave all their forces, all their time to the care of these patients, and they started, staying in hospital 2 or 3 hours more than their normal activity, involving with the interest in everything that came out on COVID, and also with a strong spirit of team. At the deep inside this, there was, however, a position which was very sad. If any one of you has seen, I think it's not an Italian movie, the movie 300, the Spartans against Xerxes, which is a dramatic movie of these Greeks going to death. That was the spirit of my colleagues at the time. They said, okay, we are now fighting, but we will lose. And at the end, probably we would get infected. And when we will be infected, the ICU will be full of other patients. So there will be no space for us. So we are fighting to death, and we won't go home. We won't see our relatives any longer. And I said, well, that's very, very sad. I don't think there is any certainty of that. And in any case, I cannot move on that hypothesis. I have to move on the ground of hope. I mean, it may be that they could be right, okay, but that was not the way to start in any case. And also this situation now that things are going better tends to leave things as they were before, a bit, and this is a bit sad, but colleagues who always felt there are doctors of first class and second class and so on. This is really a lot of silly things that are useless in normal life, and they are quite toxic, but they tend to reappear now that things are less. So I would say that a lot of people really has found something deep, but that depends really on what you meet. And this is also very important for us, because for what we have met, we are the chance for people around us to change. It's nothing mechanical. Did I explain? I know one of the things that I've seen in that period is that my colleagues were really very happy when I went to work, for the fact that sometimes I said, well, we can pray for that patient. One of my colleagues had her sister who went to ICU. And when she went to ICU, all my colleagues went down with her to mourn her sister and to assist her in some way. And when she came up, I was quite busy. And I said, well, Roberta, I will pray for your sister. And she stopped a while and she looked at me and she said, well, that's the first intelligent thing that I've heard today. And really, please pray for my sister, because this is the most the best thing we can do now, and so it's this apparently very simple position but also full of peace, because what you need to meet is the fact that at the time, in Italy, there was this sentence, everything will go better, okay, or everything will go well. And at the beginning, I was quite angry. I said, how can you say everything will go well with all these deaths around us? It's like, jumping the present and looking already in the future that we don't know how will be. Listening to my colleagues, I would say that the future was much worse than the present. So, but subsequently, leaving the same tragedy, I felt that was in some other way correct. That's the same thing that the Lord says to us. Everything will go well, but everything will go well because death is not the last word. And everything will go well because there is something much deeper than what appears, and it's really a very simple position. And with that position, you can enter the rooms. The students that came with me in the room say, we entered laughing with the patients, even if they were heavily sick, but they could laugh and they wanted to laugh and they wanted to stay with us and joke on, simple things. I cannot recall now what were the jokes, but everything was an opportunity for a joke, and they really wanted that, even if they were suffering, because that joke was a way to experience our love to them. And also, sorry, Julia, you gave me the note and I'm going on, but also in that, masks were not a barrier. At the end, the patients, I dismissed a lot of patients. I was really lucky. I've seen few patients dying. Most of my patients, I send them at home at the end. And many of them, the last days, they would say, well, doctor, I would like to meet you again because I want to see your face. But the mask was not a barrier. They would recognize us as soon as we entered the room and say, well, it's you, doctor. Yes, it's me. So.
And so we receive also a question that I think is very much linked to what you just said, like as a consequence, because at the same time, for sure, like working in this environment, everything was going extremely fast and there were many things to consider, to think about, to change. So what was helping you to keep up this humanity and this hope that you were speaking about with your patients, with their relatives in this particular circumstance?
Yeah. Well, I have to tell you exactly how things went. So at the beginning, everything started when Friday. So on the subsequent Sunday, we were called by some nuns who live here close to us, and they help children in a particularly dangerous part of Milan. They help them study. They help their families when mostly immigrants families. The parents are not able to bring their children to school because they have to work and so on. So the nuns take care of them, and we are very, very close friends with them. So they said, please come to Mass here, and after Mass we want to meet and discuss this situation and see what we can still do and what we have to close. And so in that short discussion, I saw that they were very, very much worried of not endangering anyone, but also on trying to keep most of their activities for the people, because the people needed them. And so from them, from that day, our friendship became closer and closer, and almost every day I'm in touch with them. A few nuns got infected, so I had to go there and perform swabs with them. And so this was really a very, very important friendship, because if you see people in action, I mean, it's really something that changes the way you look at everything. And also on the same side, my friends, the friends we discussed before with we mentioned before with Elvira, and particularly Giuseppe, who's the responsible of my small community of doctors. We graduated almost in the same years. And the first, it was, I think, the Saturday before, so just the day, no, it was a Sunday night, so 2 days after the start, and I had perceived that already our region had lost the grip on the situation. We were no more updated on the region website, on the region portal, and we knew all what was happening only through the TV. And I was very, very angry. I said, so people around me are calling to have an explanation, and I have to tell them the explanation of the TV. That's terrible. And so I went to this meeting with my friends, and I called my head of department and I said, please tell me something, because they had continuously meetings at the regional level, and he was involved in that because he's one of the most important infectious diseases specialists. And I said, please update me, because they will ask me something and I have to say something, but I don't want to say the things that are told on TV, because I know that TV has, you know, relatively, it's not so linked to the reality. When TV says something about you, you realize that really there are big gaps. And well, he just said, I know that tomorrow they are going to close all the part of Codogno and majors around Codogno. And so I said, well, I can tell you this. Don't ask me anything else, because I don't know really anything else. And I was angry about that. And Giuseppe said, okay, but what has this to do with the how do you say, verifying your faith? Okay, so I had to say, well, you're right. I've always been a strange doctor in some way, because I take care normally of HIV infected patients, and I often told them when they were afraid of their health, or when they said, well, doctor, when there's health, there's everything. No, I said, no. The struggle for health is a lost war. You will lose it. Sooner or later, you will lose it. So that's not the point. The point is something else. The point is why you are now in this world. You know, who wants you in this world? And to know, because every day, every morning is a gift. And so that's the point, the real point. What is your life for? How can you be useful in your life? But more than ever, who loves you so much, that gives you breath, that gives you, you know, the sky, that gives you everything that you have. And so I said, well, I think this is the point. This is the point, that we have to help people to realize, not just regaining health.
Yeah. So
Did I answer? No.
yeah, you did.
Okay.
You did. And shifting instead, like, but maybe it's related to that a little bit, the focus from the medical world. We all heard that, we are hearing and seeing also here that the pandemic is not just a medical but also a social problem, with a lot of many people losing their jobs and having major financial issues and a lot of anxiety and psychological imbalance. Is that something that you saw, and in your, especially in your environment with your colleagues and patients, and what?
Yeah, this is terrible, because when you get numbers, you only get numbers of COVID. We don't really know how huge is the problem caused by COVID in the society. I have a friend who is a surgeon, and he said that he's seen, he hasn't operated in this period, but he's seen so many suicides, a lot of suicides, because, you know, when you quarantine a person who is depressed and maybe he's alone or she's alone, you don't know, you know, the monster that that live in their mind may become terribly big, you know, and overcome them. And that is really, that's one thing. And another thing is that, I mean, because after a while I realized that really people in Italy were at how can you say, we say that the last part of the candle, you know, when you say, okay, just a few millimeters and the light goes off. And so yes, so I said we should say something, because it things might have to change quickly, but we are not ready to change them, because I said, we are not employing the police, we're not employing the army. So a lot of people are staying at home, but there are still people going around, and there are still people who did not, or who don't want to realize the problem. And if we don't force them, uh, we will just push on the people of goodwill, you know. And this is terrible, because these people are losing their jobs, and they are uh, they may have a handicapped person in their family, seriously handicapped, and so they may have important needs that are unmet in this period, or they may have a psychiatric person in their family, or they may have violent persons in their family. So the fact that I had a beautiful family, and for me to go home, and for my wife to have her children all at home, was a small paradise. It didn't mean that for anyone it would be like that. So the situation was and is terrible. And that's also why, as I said about our ancestors, because you hear people saying we must learn how to live with COVID. I don't want to learn how to live with COVID, because you know, you just think of a person who has a restaurant. He cannot run his restaurant with a quarter of the people that he had before, because they cannot stay close to each other. You know, we have to get rid of this, and we have to do every effort to get rid of this, because it's not acceptable. And a lot of people has lost their job, and also others who are, you know, living on their earnings. uh, you know, for in the period they are locked in, they wouldn't gain anything and just spend, and so at the end they would be really poor. So that's a very big problem. Yes. um, there has been some, and my children were also involved in this activity of, you know, going and buying in supermarkets for people who could not leave their home. But the limits are very high, so you can do very little, even in this case. I had to support some patients also with money from home. They just called me and said, "Doctor, if I don't get a certain amount of euros, I am not able to go on." And so I said, "Well, okay, in these special times, I will send you something because, okay, in my family, I'm not in this situation, but yeah, it's dramatic. It's really dramatic."
And so we are getting to the end of this our conversation, and we would like to ask you one last question, because as you were telling us, as you've been telling us in this, I mean, there is a lot of, it's a very dramatic situation, as you just said, for many different aspects. But at the same time, as you were telling us from some of your colleagues and your own experience, it has been made probably a time also of experiencing a deep humanity and the deepest side of life. And as you were writing in the letter to the Italian newspaper that we shared with the invitation to this meeting, you were saying, why did our eyes suddenly open up and start to see the real essence of things? And now I think, as you were already mentioning a little before, now in the aftermath, we are afraid maybe that we will go back to live life as we were doing before. So how can we keep instead living, because we don't want to live, as you said, the COVID forever, but we don't want to lose this passion and intensity and this humanity that we discovered in the last few weeks and months. So what has been your experience about that? And
Yes. Well, first of all, luckily, as you asked before, there has been a lot of people um, writing and sharing their experiences, which were really moving. Moving not just for richness of humanity, but moving because they were more intelligent ways to read the situation. And especially, you could feel that there is something that happens every day in life, and you can be sure of that. You can start your day and just ask your Lord and say, please come again today, and let me see your face in what I live. um, and this is really the opportunity, because looking at these people, as you said at the beginning, looking at those who helped us writing on newspapers. Julian Caron did it a lot of times, and also I don't know the name of Nacho, another priest in Spain, wrote a very intelligent paper on that. But they didn't just write. There were companions of road. So the first thing is really, if this new humanity has reached you through a person, don't let that person go. Ask yourself, where does this richness come from? And I wrote that this is a particular way for every person, and I cannot give the answer for others. But I can say that this is possible, and that this is something that I can bet every morning that will happen that day in my life. I have just to keep eyes open and to be free also, because we normally move with all our projects in our mind, and we tend to perceive all the things that go beyond these projects like disturbing, while these are really the proposals that God makes to us. So if you follow them, maybe you will change your path that day, and at the end of the day you will not have done the things that you have proposed yourself to do, but you have done something different, but you have followed the signs that life has put before you. And luckily, I think this is really the opportunity that we have, because COVID will disappear, but the reality is still there, and luckily the Lord, who has given to us this situation, will not leave us. Just a very short thing. A friend of mine, a nurse, said at a certain point, she said, well, my COVID ward is closing. I have returned to the normality, and my old colleagues are all complaining about money, about the time spent in hospital, and I'm really annoyed of this situation. It's like, you know, a challenging situation, but also a very clear situation has finished, and now I have returned to the normal daily complaint. And I said, well, you are in that situation, you are in that complaint, so people around you should see in your face the answer. Then they may say yes or they may say no, but they have to see that in your face. And don't worry about getting into shit, can I say? Because if our agricultors had problems with shit, we wouldn't have bread, right? Okay.
Correct. Okay, thank you again, really, for sharing all your experience and these things that I'm sure are very deep for you and very, very important. And I'm sure that your witness has been very enriching for many of us here. And we want to continue the discussion through our series of talks. And the next talk that we organize will be on Saturday, May 23rd. At 9 p.m. New York Times, and we invited Dr. Francesco Rotatori, who is a cardiologist at Richmond Health Network in Staten Island, who is now working in COVID units here in New York City. So you're all invited, and I want to thank you again, Dr. Capetti, really for sharing with us, to being here today with us, and for all your work that you are doing, and everything that you told us. I don't know if Elvira, you want to conclude? No, okay.
Okay. So now I have just to find who is pregnant.
Thank you again.
Okay, see you. Ciao.